Um, so Doug, can you tell me a little bit about um, what you've been doing in Seattle with temperature checks, teaching everybody the right way to sanitize? What are you doing over in King County?
Sure. Starting in about late June, early July, Public Health Seattle King County, through a directive from our executive's office, created what's called a Safe Start team. So, what our Safe Start team does is we do outreach with our licensed food establishments, and we're focusing primarily, although not exclusively, on the highest risk level. So that'd be full service restaurants. Typically, they might have a bar integrated into them as well. And so what we're doing is we have teams of two go out and basically we do a site visit. And what we're looking for lack of a better term, is we're looking for compliance with the governor's Safe Start guidelines for phase two in our county. And I understand it could be phase three in other counties throughout the state of Washington. And so simultaneously, what we've been doing also is trying to provide as much information in a variety of methods as possible to those operators. So we've worked with our county's business outreach group to have webinars just like this. We've tried to put as much information on our website as possible. We've produced videos. As you can imagine, there's a multitude of languages spoken within King County. So we've also created information in well over 15 different languages. And so what our teams do is they go out and they do an assessment based on 9 areas, which are really, foundationally in the governor's Safe Start guidelines. And so if there is an observation where, for example, a food worker might not have a face covering on, then our teams work with the operator more within the realm of education and not strong compliance, to make sure that the operator understands what their responsibility is for abiding by the guidelines. And if they need resources for that, then our team can provide that. And resources can be print material, of course, interpretation, whatever it takes to help folks understand and do the best practices possible to minimize the potential spread of COVID-19 in food establishments. So that's a big part of what we've been doing. But then also, from just the regular regulatory food inspection standpoint, it became real challenging because the executive's office at King County also put restrictions on us actually going out in the field and the time we can spend on the field. And certainly if you were in a high risk category, you weren't allowed to go out in the field. And we have staff who meet that classification. So we created a virtual food safety assessment program where we utilize digital technology in the form of like Skype or FaceTime to actually set up an appointment with an operator and do a virtual walkthrough food safety assessment and really focus on some primary foodborne illness risk factors, demonstration of knowledge when it comes to employee health and hygiene by the person in charge, manager, or owner of the facility, and then walking through and doing some temperature checks and reviewing other things like when to exclude ill food workers. Do you know what the symptoms of COVID-19 are, and do you screen your staff before they start their shift? So we're kind of on two fronts, helping operators as much as possible under some, fairly difficult, a fairly difficult situation, because we're used to, our profession's really interpersonal. I mean, we're used to being in the field and talking to people and doing, routine inspections and that sort of stuff. So this has put a bit of a challenging twist on that. But at the same time, we've heard some pretty positive feedback from operators that they felt like it was really important that we came out and helped them and help them understand what these guidelines mean. Because for us, we don't have any information ahead of time when the governor releases something. So, or when the governor's office does. So on October 6th, when there were some updates to phase 2 and phase 3, like additional persons allowed at a table for indoor dining, getting rid of that requirement that everybody had to be from the same household, expanding alcohol service to an additional hour. Like, we literally found out the same time all of our participants on this Zoom call found out. So that's been a challenge, but we try as much as we can to get timely information out to folks, and we're getting some good feedback. And when we're doing our STAR assessments, we're finding compliance rates, certainly for face coverings, certainly for understanding symptoms, determining whether or not they're actually screening employees, social distancing, not exceeding a maximum of 50% if you're in phase 2 for indoor dining. We're getting compliance rates usually in the mid 80 percentile. So that's pretty good when you think about that. I mean, we've literally had to build a program within a couple months and get out there and help folks. So we thank our operators for helping us with that. It's extremely important. And I don't think I can stress enough how important it is, those foundational behaviors for minimizing the spread of COVID-19 among staff in